Speak sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Prior authorizations draining time energy from many cancer patients. Break and number 148, cancer patients aren't just battling a deadly disease, and number 148, part of their time and energy can also be spent fighting the system intended to cure them, a new study says. Break half of cancer patients who needed prior insurance authorization for their care had to directly involve themselves in the process, researchers reported at the American Society of Clinical Oncology's Quality Care Symposium last weekend in Chicago. The results, researchers said, included treatment delays, financial strain and personal stress that could potentially affect their odds of survival. Break and number 156, cancer patients and their families are being pulled into the insurance prior authorization process, at the expense of their time, health and well-being, and number 157, lead researcher Alexandra Zalita, Vice President of Research and Insights at Cancer Care, a professional support service for cancer patients, said in a news release. Break and number 156, while doctors and care teams often take the lead, half of patients told us they also had to roll up their sleeves by personally making calls, filing paperwork or chasing down approvals, and number 157, Zalata said. Break for the new study, researchers surveyed 1,200 recent cancer patients aged 26 or older, of whom 74% needed at least one prior authorization for their cancer care. Half of those reported direct involvement by themselves or a family member in obtaining their most recent prior authorization. The other half said prior authorization was fully handled by their healthcare team. Of those who had to get involved in obtaining a prior authorization. 50% spent up to 1 business day working on it. 29% spent up to 3 business days. 12% spent a full business week or more. Personal involvement in prior authorizer less than /speak. Speak Tion differed based on the type of cancer treatment. Targeted therapies, 73% personally involved versus 27% handled completely by healthcare team. Supportive medications, 64% versus 36%. Radiation therapy, 40% versus 60%. Imaging, 40% versus 60%. Certain groups were more likely to become personally involved in obtaining prior authorization, including people younger than 65 on employer-provided insurance, 3.7 times greater odds, or Medicare, 2 times greater odds. Men, 2 times greater odds compared to women. Patients with advanced cancer, 2 times greater odds. Patients with delays in diagnosis, 66% higher odds, or treatment, 54% higher odds. Cancer patients who had to get involved in their prior authorizations were 23% more likely to report worse physical, emotional and financial well-being, researchers found. They also were 21% more likely to report scrimping on medication to save money. And number 156, this study makes clear what many of us in oncology have suspected: prior authorization isn't just an administrative hurdle for clinicians, it's a hidden second job for patients, and number 157, Dr. Machin Shvistek, Director of Supportive Oncology and Palliative Care at Fox Chase Cancer Center in Philadelphia, said in a news release. And number 156, this study found that patients with cancer, particularly younger patients and those with advanced disease, often have to personally navigate the authorization process, leading to delays in treatment and financial and emotional strain, and number 157, noted Shvistek, who was not involved in the research. Researchers plan to continue digging deeper into the study data, to better understand less than /speak the unique challenges faced by people with employer-provided insurance plans. Break findings presented at medical meetings should be considered preliminary until published in a peer-reviewed journal. Break sources: American Society of Clinical Oncology, news release, October 6, 2025. Break disclaimer: statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. Break and copy, 2025 Health Day. All rights reserved. Break ad as a preferred source on Google. Read this next: 700 plus CDC layoffs reversed amid backlash over cuts to disease response teams. Break and number 148, layoff notices to some 740 workers at the U.S. Centers for Disease Control and Prevention, CDC, have been rescinded. While personnel leading the Break ketogenic diet may protect against prenatal stress, study finds. Break and number 148, a high-fat, low-carbohydrate ketogenic keto diet may help protect young animals from the lasting effects of stress experienced before birth. New. Break: Joe Biden begins treatment for aggressive prostate cancer. Break and number 148, former President Joe Biden is now receiving radiation and hormone therapy to treat an aggressive form of prostate cancer, his office confirmed. Break: more news resources to MedWatch. Drug alerts: daily med news for health professionals, new drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Break: whatever your topic of interest, subscribe to our newsletters to get the best of drugs.com in your inbox. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.